Welcome back. Today we have with us Dr. ABIDA SALAM, the BHMS Diploma in Counseling and Psychology, Senior Consultant, Dr. Basil Homeopathy Hospital, graduated from Father Mullah Homeopathy Medical College Hospital 2008. Her health awareness articles have been published in different media, including Homeoshastra, National Ayush Mission, Kerala, Swasthya, Media Award. Her various health awareness videos have been posted on Instagram, YouTube, Facebook, Mojo, and ShareChat. Has given many online health awareness classes, including sessions for the blind organized by Kerala Federation of Blind, UDIS Forum. He has been a part of various humanitarian services, including events by Qatar Red Cross Crescent Society, Qatar Volunteers, Hope Qatar, ICBF Qatar, medical camps by CIC Qatar, Doha Women Forum, and Media Group Pro. She has been completed various certificate courses, including on learning disability and difficulty management, child psychology, biological psychology, etc. It's very interesting because our new generation doctors are very keen in gaining more informations than the old generation doctors. It's a very important thing. And the topic is importance of early intervention of mental health issues. We all know that as the time progresses, the more the devices are arriving, and every person is secluded in a sequestrated world of this social medias that always creating problems themselves and the society. So on behalf of IFPH, I am Dr. ABIDA SALAM. You can have the platform for the next 40 minutes. It's over to you. Please proceed.
Thank you, Dr. Manoj. Thanks a lot. Can I have the host control? Is it co-host?
Yes, you can share.
You can share my screen, right? Yes, thank you.
Yes. Okay.
Good evening, all. I hope the PPT is visible.
Yes, of course.
Okay, thank you. So good evening, all, once again. And my topic of presentation today is importance of early intervention of mental health issues. And you have got any idea why I have chosen this topic? Can anybody guess? Or I think right now even Dr. Manoj just mentioned how obvious it is that the mental health of people are really at a jeopardy. So what I want to say is, whenever we are physically ill, we all wish to take a leave. We even think about taking a leave. But how many of us actually really think about taking leave when we are down with a psychological issue or a mental issue? The awareness is too weak among the public. So that's the main reason I've chosen this topic for today. So my question which I've put forth here, whether will you take leave from work while suffering from a psychological issue? Will the answer be a yes or a no? And most probably, the answer is going to be a no. And I'm not surprised regarding that, because that's how the society views mental health issues in the eyes of, when among all the other issues, this is given least importance by most of the people. So why is it? Why do you think that this is not given utmost importance, or at least, if not hand by hand, I mean side by side to the physical illness, it's sometimes neglected by the society itself. So mostly it's because of the social stigma surrounding mental health issues. People with mental health illnesses may be considered as if they are scary people, or, they act weird or comical, or that they are incompetent in the society. With all these stigma surrounding, even people themselves feel, the people who are suffering, they feel as if, will I be secluded from the society? Will I be considered as a mentally ill patient? Even people see anxious people with suffering from anxiety disorder. The people themselves know how much trouble they are going through. But the society sees them as if Why can't they just adjust with the situation? Why are they not able to just mingle it, mingle with the surroundings? Some people even say to the others who are suffering that it's all in your head. Why do you simply overreact to the situation? But the people who are actually suffering, they themselves know how much pain or difficulty they're going through. So the main, as I said, is a social stigma, and the other one is the misconception and the lack of knowledge regarding the topic. As long as we remain unaware of the consequences of not taking the right treatment at the right time, this will prevail to continue. And that's, like I said, that's the main reason I've chosen this topic today for my webinar. Did you know that most of the mental illnesses can be diagnosed between the ages of 12 to 25 years of age? Quite surprising, right? For many of us at least, because the general public has a feeling that, we see the person acting weird or coming up with a lot of psychological issues, probably at a very later stage. But the thing is, the reality is the person would have been suffering with this condition, but in varying degrees, varying severity since a very long time. So just imagine the condition, imagine the, if I can say it as a torture, maybe that also in certain condition, okay? So now the most common mental illnesses in adolescents are the anxiety disorders, the mood disorders, the attention and the behavioral disorders. And suicide, it has been marked as the second leading cause of death among the young people, young-aged people, that is from the 15 to 24 years of age. We see a lot, right? We see a lot in the news. There will be a lot, maybe even in our friends, families, or we would have heard of a lot of suicides. And surprising, we might be surprised, like how can such and such a person commit suicide? We never even thought of that they would go for a suicide or so and so. But the people, when suffering from mental illness, some may not be visible outwards. They may be just hiding within, like because of the various reasons, like some of them which I said, social stigma being a main part of it. We all need to know that 75% of the major mental illnesses can be recognized during this time frame. So in order to have an early identification and effective treatment, this is a very important point. Now, research tells us this early identification, diagnosis, and proper effective treatments have a substantial positive effects on recovering from the mental illnesses. So you see how important it is. If we identify it as early as possible, it's like we say, we can save a life. We may usually say it regarding other acute illnesses or, various so-called physical severity in the illnesses. But how important mental health is to be noted. See, 20% of the adolescents may experience a mental health problem in any given year, and 50% of the mental health problems are already established by the age of 14, and 75% by the age of 24. So just imagine, see, if we all might be having people of these age groups, but how many of us are able to recognize that these people, they would be near and dear ones of us, they would be acquaintances of us, we would be seeing them in our daily lives, but we are not able to, see through them that they are going through such and such trouble within them. And that's the worst part of it, actually, because when you have a physical illness, you have a wound or you're suffering from other physically, which can be seen signs, you may be noticing it faster. But these people, when they are suffering, it may not be as obvious as the physical ones. So unfortunately, many people do not get diagnosed early, and so they do not get the treatments that they need. And the average delay between the onset of the symptoms and getting the intervention is said to be 8 to 10 years. So just imagine a person who would have started, probably, if suppose a child starts at the age of 12, he has been, having all the trouble and bearing with it for such a long time. Like all the reasons, if I can say, even in my clinical practice too, there are people who come to me and they say, when they say the troubles, but they still say they have a kind of, negative idea. Some people have a negative idea that counseling, okay, if I take counseling, I'll be kind of, looked down upon others as if I'm a mad person, I'm a, psychopath. So much of misconception and misunderstanding is there around this topic. So the average delay between, I said it is like 8 to 10 years. People take such long time to seek treatment. But still the people, they really are in need of help and they do not get it until much later. So why does this happen? Like I said, even from the age of 12 years, we are able to recognize these. But why this happens when the kids are with us? So even though the parents have their best intention in their mind, they may not be able to identify that their child is dealing with stress or anxiety, or is it because of the hormonal changes which is happening within them? So all these kind of confusions even make we ourselves miss out our near and dear ones who are suffering from these kind of illnesses. Now, like I said before, many people will delay a decade or more of the treatment without getting professional help they need. And this is a very big problem, because what happens is this leads them to a path of disability or to a life of impairment. Just imagine, suppose you have some issue in your joints or something as a physical, as I said, in a physical level, we see them limping and walking and whatever, for example, I say. But just imagine if it's all going in the mind of the person, but he or she is not able to tolerate it. He or she is not able to cope up with it and still going on without the treatment or management, how difficult it's going to be for him or her to carry on his or her life. This leads to even ruining relationships with family and friends. They they have inability to do a job, and many may still remain unemployed. That's a very big issue, because on the outer surface, we may just see them as not able to fit into any job. We may be asking them, why are you not getting or sticking on to a job? Or why don't you get a job? There may be people who are quite well educated, but still they are not able to, either due to anxiety disorders, maybe they have a lot of knowledge in them, but they're not able to perform well due to various, so-called mental illnesses, which are not easily identifiable. So just imagine ruining relationships. A lot of family problems arise because of this. It could be between the husband-wife relations. It could be between the parents and the kids. It could be either way. And with the friends. Obviously, friends who understand real well might stick on, but it can be kind of frustrating for some of them when, the friends who are together, if they are not able to realize that the friend is actually going through a mental disturbance, and you see them acting weird and they are not fitting into the friend circle, what usually is going on within them. So all these are affecting the relationships. So this is even more hurting for them. So this makes them even more vulnerable too. And psychiatric disorders also lead to premature death and persistent disability among the young people. And early identification and providing enhanced long-term care is very critical for those who are most at risk of developing life-threatening or chronic diseases. We know, a lot of us know that there's a lot, we can say it as psychosomatic disorders, that it's all linked between the mind and the body is linked. We being homeopaths, we all know that. Even otherwise also, it's very obvious. So now, what is early intervention? Early intervention refers to the proactive approach of identifying and addressing mental health concerns in their early stages. That is, ideally, before they escalate into a more severe or chronic condition. like I said, if, as we said, from 12 years onwards, we are able to kind of diagnose them. There are people suffering with all the issues. But if we see them at an early age, meaning at the initial stage itself, if we are able to identify them, if we are able to offer the support to them, if they are able to deal with these minute changes happening with them, we can give them a lot of, coping mechanisms, as well as they themselves will adjust to these situations. They are able to understand what's going on within them and see it with a more positive outlook, rather than bearing it for so long and then it just escalates into more severe conditions, which actually sometimes it's way out of control that they themselves have no control over, and it takes a longer time to get them back to a little milder situation. So this approach involves comprehensive mental health assessments, including evaluating a person's emotional, cognitive, and behavioral functioning. It is essential to recognize the warning signs of mental health issues and seek help from a mental health specialist. Early intervention is very critical in preventing more severe mental health problems that may interfere with an individual's daily activities. Like I said, see, a person suffering from any sort of mental health disorder, it can be anything. Each of the disorders have their own, difficulties the person faces in their daily activities. Like I said, at home, it could be within the family, they face difficulties, within their friends, within their work life. If it's a person who's an adult and a working, they face a lot of difficulties in their work life. If it's a child who is at school level, they face a lot of difficulties. Many kids come with a difficulty in facing exams. For example, they are just common things. That's what they might feel it as a little prominent, and that's when they sometimes seek help with us, because they don't know that a lot of other issues are going on with them. They may just notice that you're not able to perform well. They're actually studying well, but they're not able to perform well. They're just forgetting stuffs. But there could be a lot of things going on within. So what are the benefits of early mental health intervention? It can have numerous benefits for the individuals. If I can say, it's more like reduced need for the intense treatment. Like I said, when we get to know the symptoms earlier, we don't have to go in for an intense treatment. The earlier we find it, the better and easier it will be for treating. For the patient also, it will be a lot better. And fewer logistical implications will be there. And like I said, there will be improved school or work performance, because that's one of the main things which gets affected when you are in a social life. So explaining it a little more, when we say about reduced intense treatment, the early intervention of mental health can prevent the development of more serious mental health problems. Like I said, the more intensive kind of treatment methods. And addressing these concerns earlier might prevent the need for lengthy or costly treatments, and the overall recovery process can be more quicker and less painful. Actually, I wish to give some clinical examples. We'll see if there's, by the end of the session, if there's time. So I may just give some clinical experiences of my own, a few of them, which will kind of help you in understanding what actually this means. Now, the second point, that's a fewer logistic implications. Early intervention can also help prevent disruptions to a person's daily life. I already gave a glimpse of what it means, including the school or the work absences. Like how many people, they are not able to cope up. Maybe the at work people may not, like I said, take leave. They may kind of back off. It's not that easy to get a leave from office. Probably people working in an office may not even think of saying that actually I'm suffering from a mental health disease because of this whatever stigma and be said. But at school level, the kids may not be aware of what's going on. The parents may not be aware of what's going on. They may be kind of there'll be absenteeism. They'll be kind of, staying aloof from school or whatever. And there will be, like I said, strained relationship between the family and friends, and the other logistical implications that may arise from untreated mental health issues. Now, next, the mental health problems can interfere with concentration. That's what I said, like when it comes to school and work, what happens? If they are not able to concentrate in a class, the teachers may be complaining. The kid may have a lot of difficulty adjusting with the peers, going on with his curriculum, his or her curriculum. The child may be trying his or her best to learn. But the fruits, it's not becoming fruitful. So these are some of the things which we see. And if the early intervention is not done, these keep escalating. And it obviously will affect his or her confidence and the like. So therefore, addressing these mental health concerns early can improve the academic and work performance. And one important thing is when we find that these kids have some difficulty in balancing with their education or due to some mental health issues, what's going on, we'll be able to provide the coping mechanisms. So when they try to accommodate them into their daily routine, they will be better at achieving their goals. It will improve their mental levels as well as their confidence. And obviously, it will go on to improving and attaining their goals, what they had in mind. Early intervention helps educational and developmental diagnosis as a valuable tool for parents and children, like I said just now. So it will be easier to identify like what's the child facing. Are there any developmental delays? What are the academic challenges the child is going through? And the IQ level, all those will be addressed once it is early identified and intervened. By diagnosing these factors early, the alternative teaching and learning methods can be implemented. Like I said, what the coping mechanisms, what are the different, it's kind of customized for each child, I can say, because if it's in a school atmosphere, for each student of the child, it can be customized according to their needs, how much the child can grasp, what is the best way of therapy for the child that can be followed in such cases. So this will help obviously in the long-term success. There are clinical examples, maybe one or two, or one at least, I might say at the end of the session, or if I want, maybe I guess there's time, I can just say one example here for this. There was a child, actually his mom brought him for counseling because it was the so-called problem child. Like she said that he has become like a problem child. He's not attending classes properly. He's not doing his schoolworks. He's not attending. The teachers complained that he's being kind of, disruptive in the class. Neither does he sit in a place in the class and attend, nor does he allow others to. So it's kind of like, the class is also disturbed. The teacher cannot, it is also disturbed because not only does this child is affected in his learning when he walks around in the class, when he is distracting others. So the other children, other students in the class are also affected. At home, also the same situation. The mom says that the child is always moving around and you don't get him to do his homeworks. In short or in general, it was like he is being kind of like a problem child. So that is how the child was brought for counseling. But when you dig deeper, it's like the child is not doing the homeworks, not studying all these issues, but the child really was not able to cope up with all these. So the first day I can say the child wasn't even looking at my face. Like it was online counseling session. The child wasn't even looking at my face. He was too kind of aloof. He was just sitting beside his mom, and his mom was trying to kind of tell him like, see, doctors looking at you, trying him, trying to make him communicate with me, but the child would never open his mouth. He would just, during the whole session, he just hardly gave few side glances, just when his mom said a few glances. That's it. Other than that, nothing he was saying. But that child later, I can say, kept improving. Each sessions he kept improving. And not only did this child whom was, stamped as a problem child, he was later his own mother who was so much in distress because of the behavior and because his irresponsibilities and backwardness in his studies. This same mom later was so happily saying that he not only is doing his academic stuff, he's doing his homeworks. In fact, the mom who used to say that I call him for the homework, I make him sit, but he never comes. And if at all he comes, he hardly sits there for a few seconds or few minutes. He just runs away and he just goes on his own. And it's so difficult to let him make sit in a place. And that child, he reached to a state that when his mom comes to help him for homework, he says, no, mama, I'll do it myself. So that is the improvement. So just imagine if this child wasn't, given the intervention at an early stage, this would have been like, he would be just like being considered as a problem at house, problem at school. And yes, even at school, the teacher who used to say, who had a difficulty in, putting the child back in seat because he used to keep, but he was a small child. So, you can't impose too much on small children. So the teacher said he sits properly in class, he listens, he has become a very good boy in class. So that much changes. And to cut the story short, by the end of the year, the exam, he was actually a child getting only D's. Always the grades were in D. And by the end of the year, mashallah, by this end of the sessions, the exam results came and he has got an A. So the mom was so happy that not only was his academic performance, it reached an A, plus his, and I forgot to mention the initially how I said he hardly looked onto my face. That was only the first day. He kept improving. In fact, he used to be the one to start the conversation during our next session. So that much has improved at home, his social life, his academic life, his behavior, everything changed all. So just see the link, how much is going on with this when a child is suffering. So if we go detail, the time is just going to go. So we'll just talk about the case over there. So now next is learn positive communication and coping skills. So this will help in improving the socialization and encouraging friendship. Like I said, for example, just the case we mentioned now, like how much he changed from a person who was not socializing, from a person who was not, he didn't have much of friends also. And so all these, when one started, it's like when you start putting one thing and connecting one thing and correcting it, everything falls in place. That's what kind of happens here. Okay. So early intervention can also teach individuals positive communication and coping skills and improving the socialization and encouraging friendship. Then by developing healthy coping mechanisms, individuals can reduce the impact of the stressors and work towards a more fulfilling life. Then the decreased frequency and severity of ongoing symptoms. Like I said, when early intervention is given, the same intensity, if it was not intervened, it would either just escalate, or the child or the adult or whoever is suffering would be going on with this for a longer period of time. But this, when the early intervention is given, the frequency of difficulties the patient is facing is reduced, and so does the symptoms. Symptoms also reduce. And the early intervention can improve the likelihood of extended and complete recovery from mental health issues, which thus allows the individual to regain control over their lives and achieve their goals. That is quite obvious, because once it is early intervened, the level of intensity of the symptoms will be less. The level of treatment methods required will be less. The level of adjustment will be easier for even the patient to, cope it up and adjust with the surroundings and adjust with the tasks or the methods we are providing. So the overall outcome will obviously be better. Then this boosts self-confidence and motivation. Like I think I already mentioned it, a bit of it. That is the confidence. Most people, when they come with such any of these kind of sufferings, they would be mostly at the, the last bit of it, like they have lost all the hope. They just, they have no feeling for themselves. It's more like, I'm good for nothing. I'm so and so. Why am I like this? Or why am I not like the others? Why only me? And no confidence, even if they know that they have a lot of capabilities in them, they are not able to bring it forth. So all these are pulling them back. But once all these are addressed, when it is, intervened earlier, this can boost their self-confidence, because once they start adjusting to the situations, once they start carrying on with what is supposed to be done, how to adjust with it, when the therapy is done, all these will increase their self-confidence, and this will motivate them in doing better, and obviously it will bring on the empowerment. So this will lead to more positive outlook and a greater resilience in facing the challenges. So now we said of all these, like the mental health, how much they suffer and all these. So to get a glimpse of it, now what are the signs that you see in the people who are suffering? It could be either anyone. It could be maybe any of you sitting in front of me. It could be either any of your near and dear ones. Could be anybody in the family. Could be anybody in your friends or social circle. It could be anyone. So just look out for these signs either in yourself, or so that we are kind of, noticing it earlier and we can offer support. So please see to it. Now, these are the main signs which we see most commonly, okay? What we most commonly see are feeling sad or hopeless. It depends on which condition the patient is suffering. It's not that all these will be seen in one person, obviously. It will be like whatever the patient is suffering from, any of these could be shown, or one or more of these could be shown. Either the patient is feeling hopeless or very irritable and feeling sad. And by feeling sad, I don't mean, see, feeling sad is common. If something really sad happened in a person's life, he or she will feel sad, but it's not that just once. It's like recurrently it's coming. The patient himself or herself doesn't know the reason for it, or being too hopeless. It should be for an extended period. So that's when you need to look out for something, ringing bells. Now, loss of interest in activities which you used to enjoy. It can be identified more easily, like you might be having a friend or somebody in your friends or somebody in your family or relatives who was actually very good at, for example, if I say dance or singing or into sports, he or she was so much involved into it and so much fond of it. And then you see them that they are no more into those. That can actually, bring on suspicion. It's not that it's always that, but it's always good to look into it. Whether is there anything going on? Are they going through some difficult times? So that we can, give them the right guidance. Then there will be difficulty sleeping. Difficulty sleeping can be both ways. Some people, it might be that they are just finding it too difficult to fall asleep. Late in the midnight also, they do not get sleep. It's like insomnia, but it can be even hypersomnia. They just sleep throughout the night, but still they are never feeling refreshed. They, in the morning also, they just feel like, sleeping lots and lots, and still they just cannot get over it. There can be changes in the appetite. It can be either like anorexia. They may not feel like eating food, or they may be kind of not having an interest to eat, or it could be the other way around too. It could be that they are eating too much endlessly. They just, too frequently eating. For some, it may be that they're eating too frequently. Some can be they have no count of what they're eating. They just eat and eat, like a bulimia, just examples of them. So this will eventually, either of these might lead to either significant weight loss or significant weight gain corresponding to what symptoms they are going through. Then there can be decreased energy or motivation to complete the tasks. They may start with so much of interest or whatever, but they finally may not be completing it, either due to lack of energy or they don't feel enough motivation. They just start, but then they don't complete the tasks. Then there's difficulty in concentrating or making decision. This is a very difficult thing if it happens for school or work life people, because difficulty in concentration and making decisions is so very important. It's important in everyday life, but especially these will really affect their performances and end results. Then there will be increased use of drugs or alcohol. It's not that everybody suffering from a mental health issue goes into this, but this is also a point to note, because drugs and alcohol, people may go into it. This could be one of the reasons that they are either going through some mental issues within them, which later leads them to depend on drugs or alcohol. And the thoughts of self-harm and suicide, like I said previously that suicide or self-harm, we may be shocked about people who committed suicide. We never would have expected that this would happen to them. How many we have heard? We would have heard very well-known people. We would have heard people in our community who has gone through all this, and people will be shocked or surprised. We never expected this would happen to them. How could he or she? We never knew that he was going through, such and such difficulties, or what was the problem he was going through. He was having the life, such a wonderful life. That's what we see on the outer, but inside they may be having a lot of troubles which were not, as obvious, or maybe we failed to notice in them. Then there can be the changes in personality, such as becoming more withdrawn or aggressive. More withdrawn can be identified like a person, like I said, who was very sociable, very friendly, could be that way, but they all of a sudden don't feel like coming into the public gatherings, or they just feel like sitting alone at home or somewhere, secluded. That is what they feel like doing. The only thing they want to do is either stay secluded or away from the public, because they feel so much awkward being in the public or, facing people. Or it can be the other way too, that they're being so aggressive. But all these are out of their control, probably. They just cannot control it on their own. So they don't know what to do. So that is when the importance of early intervention comes in. Then the physical symptoms, such as the headaches or stomach pain. Yeah, like I said, there are a lot of physical symptoms which come. Sometimes the blood reports or what are the investigations may be saying as everything is fine, but still the patient actually will be suffering. It's not that the patient is faking it. The patient actually suffers it. But these could also be linked with these psychological issues. So the early intervention for mental health can prevent more of the serious mental health issues from developing later on. And research has shown that early intervention can improve the outcomes and prevent the progression of mental health conditions. For example, early intervention for psychosis has been shown to improve symptoms and decrease the likelihood of the relapse. There is a potential for early intervention and prevention of mental health disorders, which what they can do is you can include exercise, healthy eating, stress reduction techniques, and therapy. And early intervention can help the individuals develop coping strategies and prevent the development of more severe mental health conditions. Now, what are the effectiveness of these interventions? It can actually vary depending on the individual and the specific condition for which they are being treated. The research has shown that early intervention can lead to better outcomes, like I said before, So it's always essential to seek the help from a mental health professional to determine the most effective treatment plan for your needs. So what are the strategies to prevent these mental health condition? There should be increasing access to the mental health services. The access should be easily accessible for the people, because then only if people are suffering, they feel like, seeking help. Like I said, especially when all these negative ideas and notions are there among the general public, as long as the services are not easily available, people might back off to seek help. Then promoting early intervention and reducing the stigma. Like I said, reducing the stigma is actually really important. The awareness is to be brought on. Like each of us, it's not that just me. I just chose this topic for a webinar, but each of you who gained this knowledge and who already, many of you might be already knowing a lot of these. So each of us has the responsibility to reduce the stigma actually, so that we have a better society and surrounding us. And integrating mental health care into primary care settings so that it's easily detected and the patients are given care at the right time. And promoting the healthy lifestyle behaviors such as regular exercise, like I said, healthy eating. This can also help prevent the development of mental health conditions. So now, this is the one tip, if you ask me to give, is take a break. If I say out of all these, this is the one tip I can say is take a break. Why? Because take a break meaning from our regular routine. Each of us have our own, difficulties and normal daily routines, which are full jam packed. It's like 24/7 we are working, or whoever may it be a professional, may it be even a housewife, even whoever may it be. Any person has their own, busy schedules. So when you take a break from that daily routine, it actually really works wonders. And we also need to normalize that it's okay to take a break, because it shouldn't be there like, oh, he or she hasn't finished his work. And then where is he going on a trip? Or where is he, just lazing around? No, this needs to be normalized, that if a person needs a break, he really need to take a break. And that's really going to help his mental level, as well as along with that, the physical activities and, overall betterment will be seen for sure. If you haven't tried out, just try it out. So, but still, again, saying once again, but all of this said, if we are in need, never hesitate to seek a professional help. So take care. And that's all for now. And if there's still time remaining, is there
Yes.
time remaining? Yes. I can just say a few more
It's time to
cases.
take a break, I think.
Okay.
If
Time
somebody
to
would
take
like
a
to,
break. There
yes.
are a few cases if you want. I can just, it's not, I'm not going to say detail about the case. Like I said, during the slides, I had just mentioned of some clinical cases to show the importance of early intervention. Just a few, not in detail. Obviously, I won't go in detail, especially, considering the patient privacy, confidentiality. But just to give you the how important it is, how much an early intervention can be helpful when compared to some mental health condition which is treated way late. Okay,
Yes,
so for
please
example,
proceed. Please
yeah,
proceed.
yeah. So it's like, for example, there was a 13-year-old child. She comes to me. In fact, her parents brought to me because she was not. Somebody raised hand. Okay.
You
Okay.
just complete what you want to, please.
Okay. So the child was brought because she was suddenly staying aloof from her daily activities. And it was, I need to appreciate the parents who did that, because they actually did it at the right time. It was actually quite on time. When they saw some changes in her, they got her. And it is that the child was actually kind of going into a depressive state, but at the initial stage. So as long as and the first time when she, so the time, that is just with one sitting, she changed a lot. So why I want to say is, the earlier she was brought, it really impacted in her. The person herself, she changed a lot. She was not eating properly. She was staying aloof from her friends and all her daily activities. Just with one session, she changed, and she is back to normal and happy. And so this says, and especially those parents were actually aware of the mental health related stuff, so they brought to me. Now that was one case, that is very quick, just within one session. Now I say there was another patient, 18 years of age kind. She had been suffering some a little before too, since a few years, not as early as this child. So she had previously had a counseling session before with some other counselors too. And then when she's coming to me, she came with the trouble of not able to perform during her school, mm, you know, representing in the class, uh, some project or some presentation in the class. So she was actually suffering with the anxiety issue. She had studied and prepared so well, but she was not able to perform. She felt so, left out. She just uh, cried in the class, and she felt so bad for herself. And she still had one more presentation to come, and that's when, in between the time, is when she came to me. So this, what helped us, she improved in her next presentation. Not only did she feel so light after the session, she also performed well in her next presentation, and she has improved a lot and is still improving and much better. But I say she required, like I said, she previously also had some issues, so the duration is little more increased. I hope you understand the difference, that the duration is increasing. We need to give a little more sessions, or even the child or the person might take a little bit more time to adjust. And there are more, but just one last, which I say it's a little bit, it's actually quite complicated case, and I wouldn't say a lot of it because of the too much details and confidentiality in that case. But just I would say is, why I say the importance is, this patient was came actually contacted me for relationship issues. To be frank, it was sexual relation issues. And when I got deeper into the case, it was more of, he was actually not even a married person, and he was asking for sexual related doubts because he was having multiple sexual partners, and so that is what he came with. But when gone deeper into the case, when he later slowly opened up a lot of things, and when you went to the core of what, from where all these started, we could actually have been, the main thing about this, especially mental health issues, is we should never be prejudiced. Like we say in homeopathy, we shouldn't be prejudiced, but it's, we might just go into some prejudice, like why he or she is doing such and such nasty things. But as the person opened up, he's around 30 years old, but as he opened up further into his history, he said that when he was a child, he was sexually abused by a lady whom he trusted so much. So it's more like, and that was the first time in his childhood when it happened, and he was devastated by that, and that actually stayed within him. And then later, he was again used by some other ladies. And it's more like, if you look back, like how this person's life was, until, like, in a normal happy childhood, after this event, after this history of trauma, this sexual exploitation which happened to him, he changed a lot. Actually, I feel, if why I mentioned this case here, there's a
Okay,
lot of
doctor,
things which I can.
excuse me. We
Yes,
want for discussion. Dr. BRT Stasner is raised hand. Dr. Sridhar,
yes.
please conclude. Yes.
Okay. So why I say this case here is because if that person
Yes.
was
Dr.
actually
BRT, madam,
improving.
please. You can unmute now. Yeah.
Okay.
Yes, please. Dr. BRT, please. Yeah.
Okay, okay. Dr. Abida, once again, we see this week. So
Nice to meet you again.
I'm very happy to hear you. And I would like to give you a big compliment. Not only you are speaking very well English, very good to understand, but we can really feel your deep interest in psychological patients.
Thanks a lot.
And
Thank you.
yeah,
Thanks a lot.
we can really feel because and your parents, you have to start early, and you are totally right. And it's not so easy because we need a lot of patience
Yes, yes,
with
yes.
these kind,
Sure.
yeah, with
Yes.
these kinds of patients. And I can say in my practice of general medicine in Germany, more or less 50% of my patients have psychological problems,
Mm-hmm. Yeah,
more or
yeah.
less,
Yes.
and are making out of this, are having physical symptoms also. And I totally agree with you. To have a depression, I never had a depression, but to have a depression, it's a really severe disease,
Yes.
and they're not living a normal life. So you are totally right. We should consider that as a patient, which emergency in a certain form. And happily, our homeopathic remedies are helping in different kinds of situations. So, but one question I would like to have to you, if you talk about early interventions or about interventions, what do you mean? Do you mean homeopathic treatment, or you also mean different forms of psychological procedures? That's my question.
Okay, so it can be all these included. That's what I said. It depends on each individual case. Suppose when you hear from the patient, there might be a patient who just needs a bit of counseling, but there might be a patient who has similar issues. But for that patient, along with the counseling, side by side with our treatment, medical homeopathic treatment, it works wonders. Sometimes a patient may benefit more from homeopathic treatment. So it depends more. But obviously, all these therapies side by side will help in quicker, easing out the therapies, easing out the healing of the patient, and patient being able to, coping with all these
Yes,
changes.
that's
Yes.
true.
And
So
in
I understood. And could I mention one comment from my side? With my psychological patients, if they have
Mhm.
anxieties, it's a bit more easy to treat than depressions for me.
Yes,
And
yes.
you know what, for me, I really like very much um, to give LM potencies every day,
Yeah, yeah, yeah.
because sometimes they have to take chemical drugs. Okay, if not, it's a more regular way. And if you
Mhm.
have a high potency, you have to wait, you have the waves. So I
Yes.
really, with my psychological patients, I
Okay,
like to
okay,
give these
okay,
LM.
okay, okay,
Yes,
Dr.
yes.
Beatrice.
Dr.
Now,
Manoshi knows. Yes.
Dr.
Yes.
Sridhar Group is waiting. Another patient is
Okay,
waiting.
sorry.
Yes, yes. Sir,
Thank
Sridhar
you,
Group, sir,
Beatrice.
please
Thank you,
unmute.
Dr. Beatrice.
Yes, thank you, Dr. ABIDA SALAM. It is a very good class, excellent class. I appreciate you. I like
Thank
to
you.
ask first one question, whether your few cases you mentioned, whether you used homeopathic medicine or psychology treatment, what you done?
Actually, in both of these, which I have right today mentioned, I didn't need to have giving medicines. Just by counseling sessions, they have improved. But there are cases where, like I said just now, told Dr. Beatrix, there are cases where, especially in long-term cases, where they would have been suffering their intensities would have gone real bad. So we do not
Yes.
want them to, just depend. We give side-by-side counseling along with our medication. We wait. First, we try counseling. If we feel
Yes,
instead of
Dr.
simply
Abida,
making, yeah.
the question is about your case. That is, you have already answered. Okay. Now, Dr.
Okay, okay.
This is over. You have only limited time. Yes. Okay.
Okay.
Yes. Now, Dr. Hubert, please.
Hello, Dr. Abida. Very nice presentation and very much impressed. So I want to ask you, Doctor, when in the childhood, many parents are saying some materialistic growth, giving them materialistic more importance to make money rich and that time. That may
Some technical problems. Now, Dr. Amir Malik. Dr. Amir Malik, are you there? Please unmute. And only 2 minutes remain. Dr. Amir Malik, you can unmute. Please. Yeah.
Yes, sir. Good evening, sir. Namaskaram to every honorable doctors and members of IFPH. Honorable Madam Dr. Abida, very great session you have given. Unfortunately, here is very strong, rain. There is no light. Just comes and I have catch the topic. The psychologically, when depressions, anxiety, personality disorder, some kind of abuses, either whatever the abuse is, if it's locked in the unconscious, conscious, and superconscious, human mind is very, very, very strong thing. When the things are locked in the unconscious, the personality become, it will be either a dangerous personality for the world, for the peoples, or it will be a calm personality. It will become a patient, anxiety, psychopathic issues. This is a very big thing. Nervous system, human beings nervous system is very, very, very strong thing in the world.
Okay,
And
Dr.
I
Abid
believe,
Malik, do you have any questions? Otherwise, you go to
yes,
yes.
Honorable Madam Doctor, first of all, I'm thankful to you for your nice and great lecture. It's a very good, your lectures are always very interested. I really appreciate it, a lot of appreciation, and God bless you more and more. And second thing is that please do have a vision what the medicine you give to unlock the unconscious anxieties and depressions and psychopathic issues, how it would be unlocked. It's very important. And what the medicine you're given to that patient which cures, because I cannot attend your lecture completely due to the light issue.
Yes, yes, you can see in YouTube, doctor. Don't worry. Okay.
Yes.
Yes, yes.
Okay, I've not given actually for the cases which I've mentioned here, it was only counseling, but
Yes,
otherwise
yes.
I'd mostly go for
Yes.
constitutional remedy.
Okay. He did not attend. Dr. Hubert, please. Yeah.
What is the technique? I asked you, what is the technique of making the treatment pattern they are giving much importance to material things in childhood. That time they are growing to make the money. That time the children may be spoiled their life to make money. So such persons, what is the technique? Just want to know the technique,
Okay,
what you are
here,
using.
if there is a wrong notion at the side of the parents that the child is suffering, then we obviously give a session for the parents also to correct their negative thoughts, like all these kind of thoughts. Just an example of what you said.
Thank you. Thank you.
Okay. Well, it's time to wind up the session. May I invite Dr. Beatrice to express a lot of thanks. Madam, please.
Yeah, thank you. And Dr. Abida, thank you so much for your very, very heartful presentation. And you can feel many questions. We are all affected with these kind of patients in our clinics. So thank you very much for putting that problem on the top and also explaining really well. We have to start early if we see the problem in the children. And thank you very much for coming. And perhaps you will have the possibility to present some actual cases and also with some homeopathic remedies. So we would be glad, and thank you very much to IFPH to be so dedicated organizing these Zoom sessions every day. Thank you very much, Dr. Huber, Dr. Manoj, and it's always a pleasure, and greetings from Germany.
Thank you.
Okay. We can say a proud father behind Dr. Mr. Abdul Salam sir is also there. So with that conclude today's English edition. Hope you that will be again tomorrow. Till then, goodbye. And Dr. Shaila to continue the program in Malayalam. Thank you.